There you go.
Awesome. We are excited to have everybody joining us today. This is a pretty fun group. We've got a good hour here to chit chat and get to know one another. Welcome to everybody who's coming on board right now. My name is Kristin Russel, and you are in the symplr Komen second annual Fireside Chat here. And we are absolutely thrilled to have you guys. We're going to do our best to kind of keep this sort of light and engaging. We've got some great questions, some terrific panelists today. Let me tell you, in honor of Breast Cancer Awareness Month, our webinar today is going to focus on the power of research. And if we'll go to the next slide here, Breast Cancer Awareness Month with the power of research. I've got my friends from Komen. I've got BJ Schaknowski with me. I'm going to introduce those two in just a moment, but we really wanted to make sure that you understood the focus of our webinar is all about driving research. We're going to talk about research, action, community, care. We're going to hear a little bit about Komen's 360-degree approach to evaluating and investing in technology. Technology that's ultimately all about really providing the greatest benefit to the patient. Now, like I said, we've got some incredible leaders with us today. Let's talk a little bit about who's sitting here on the panel. Like I said earlier, I'm Kristin Russel, I'm the host, but more importantly, we've got Victoria Smart. This is Susan G. Komen, Senior Vice President of Mission, overseeing research. And also with me today is BJ Schaknowski, our own CEO here at symplr.
You can call me BG Schaknowski. It's okay. I've been called a lot worse.
A little bit of the BGs and the yeah. So there you go. I think we're like 1 minute in, and I've already started with my first cheesy joke. So we're right on cue. We've got an agenda today, folks. You'll be happy to know. So we do have some structure to this conversation, and we've got some great topics that you're seeing up on the screen. To start, I want to share a little bit about the sponsor of today's webinar, and that is symplr. Hopefully, you're all aware of who symplr is. We are the leader in enterprise healthcare operations, software, and services. We are running in about 9 out of 10 hospitals across the United States, really committed to improving healthcare operations. And we do that with solutions and offerings that support workforce management, provider data management, compliance, quality spend, healthcare governance, risk management, all across the board. Our goal is really thinking through how do we improve the efficiency and the efficacy of healthcare operations so that ultimately, that's a lot of words, but let me just say, if we do our job well, healthcare workers have more time to do what they do best, and that is care for our patients. We're a proud partner of Komen. They are at the forefront of breakthrough work to combat breast cancer through research and community health, global outreach, and public policy initiatives. Now, with all of that, let's start. Let's get into this a little bit, because I've got, like I said, I've got some pretty impressive panelists today, and we've kind of gone through the big stuff. But let me start off. We're talking a little bit about the power of partnership. And so, Victoria, a question for you. Tell me a little bit more about yourself. First of all, why Komen? Why research? How did you get here on this call with the two of us today? With this, the happy clan from symplr.
I mean, how could I resist? You know, joining such an incredible group and an incredible session today, especially when you positioned it as being both fun and impressive. So I hope I do a really good job for you and the team today. So first, I want to thank you all for inviting me to join you during October, which is such a big time for the fight against breast cancer. So it's really important and exciting for me to be with you here today. So I'll tell you a little bit about myself. Much like BJ, I had a complicated last name before I became Victoria Smart. So I want to say that, like, I feel for you with, you know, folks, I feel for you. I used to be a lot of Velodco, a lot of vowels in there. I went to Smart, you know, and I understand.
I'm a lot of consonants, but yeah, it's fun.
It's a lot. It's a lot. I've been in the fight against cancer for about 25 years now, and I started at the American Association for Cancer Research, and that was back in my hometown of Philadelphia. Go Eagles. That's where my love for scientific research began, right? Because the cures for breast cancer are going to come from research. And so that's where I started. But to me, even when I was back at AACR, and we were all about driving forward scientific progress, the ultimate beneficiary of that progress is our patients. And to me, Susan G. Komen was always the shining example of patient advocacy, putting patients at the center of everything that's done in this fight. And so an opportunity came to me about 13 years ago to join Komen, and that was to build their research program into the powerhouse that it is today. So it was very easy for me to jump with both feet. And today, I lead all aspects of Komen's mission programs, and that's research, community health, and policy, like you shared. But I want to tell you a little bit about Komen's investment. We've made over $1 billion investment in research, and that's made us the largest private funder of breast cancer research in the world. But we've also coupled that with investment of about $2 billion in patient care and advocacy. And we've made great progress. There's been about a 40% drop in the mortality rate, but lives are still being lost, and that's why we need to try harder. And we do, because you need a lot of relentless tenacity to be in the fight against breast cancer. Can I say something about BJ? Is that okay? I think that brings me.
No, not.
Can I? Right?
Agenda. This is not on the agenda.
Is it okay if I say something? Because
you're going to regardless. So
I'm like, what? How do you even connect? Well, how did the two of you guys know each other?
I'm going to tell you about the tenacity. Besides having the shared complicated last name, I think it's the shared tenacity, because you have to really be a tenacious leader to take on the challenge of improving healthcare delivery. And that's exactly what you're doing at symplr, and why your mission resonates so strongly with ours, and why we just had that shared synergy. The work that you're doing to ease the burden of providers through technology, giving them more time with patients. We know 100% hearing from our community that leads to better outcomes, being seen, being heard. It's a goal we share at Komen, better delivery of care. So, that's no easy feat, but when you have a leader like BJ, failure is not an option. A U.S. Marine knows how to lead a team and get the job done. Full disclosure, I'm mostly an Army family, but I know I can say that about the Marines. It's okay.
We can't all be Marine Corps.
BJ, I know you bring that same level of commitment to our mission here at Komen. We're thrilled to have you.
Victoria, real quick, you mentioned this sort of 360-degree approach: research, action, community care. Can you just kind of drill into that a little bit more? What does that all mean? It's a lot of words.
Yeah. I'll touch on that, because I know we'll be talking a lot about research here today, but that's not where Komen's mission programs end, because our research breakthroughs are only going to be impactful if we can get them delivered to the patients who need them. And so that's where Komen's community health programs and our Center for Public Policy come in. We're here to get discovery to delivery of care. And so our patient care center has a team of about 30 patient navigators, and we help patients get educated, get connected to care. We want them to feel supported through their journey, and we do this all free of charge. And so I want to say, if anyone watching ever needs support, we are a phone call away at 877-GO-KOMEN. But we also engage in DC and our state capitals through our Center for Public Policy. We have about 150,000 volunteer advocates who come with us. They're ensuring that through policy, care is affordable and accessible to all. People watching today, you too can be an advocate. I can tell you later how you can get that done and join us as a volunteer. But quite literally, Komen has breast cancer surrounded with science, with patient support, and with sound legislation.
So, BJ, I think even after hearing this, Victoria, I think we can all probably imagine, why would BJ want to get involved? But how did BJ get involved? How did this all come to be? And maybe even BJ, in your own words, why Komen?
Yeah, so when I became symplr CEO, I've always had a belief. I've been very fortunate to work for companies that I think have had a real DNA of aligning, as I've heard it framed so elegantly, purpose with profits. And I think to be a successful, sustainable business, you really also need to be a wonderful member of your community. You need to engage in activities that really support the constituencies that you serve. And so I think, being a great corporate philanthropy partner is just really, really, really important. And I think it's really good work that we get to do. It's not often the thing that we talk about in business, but for so many of our team members and our employees across multiple companies I've worked for, the charity work we've done has actually been one of the most rewarding parts of going to work every day. It's super cool. And so when I joined symplr as its CEO, one of the things we were looking at was, I've primarily been engaged in being a prior service Marine, veterans philanthropies throughout my career, the USO, Wounded Warriors, Injured Marine Semper Fi Fund, amongst others. And we thought it was important to also make sure that I lead from the front as a CEO of a healthcare technology company and really find the appropriate philanthropy to lean into. And so we work with some folks who kind of were helping us to identify the right opportunity. And interestingly, coincidentally, at the same time this was happening, I just met Paul Schneider, who's the amazing CEO of Komen, and we found out that my aunt, my mom's closest sister, had been diagnosed with breast cancer. And talk about making it very, very, very real, very, very, very quickly. And I knew very little about breast cancer, and I knew of Komen, of course, through the marches and the walks and the runs and the football players wearing pink during October, but I didn't know much more than that. But it seemed like a great opportunity to get involved with a national organization, which is important to us because we have employees everywhere. We have employees all over the country, and which offered a wonderful opportunity to get involved, but then also it made it very real for me. I think that matters, right? And so met Paula, found out about my aunt, got involved with Komen, but since then, what an awakening it's been, because while the community is powerful, and I mean powerful, of these women and men, by the way, right, who've been diagnosed with breast cancer, but the work they're doing around the research side, and this is why I thought this call would be so important to bring Victoria on and talk about it. I had no idea the amount of research going into actually eradicating breast cancer, right? I had no idea the amount of legislation required to fund the research and to take care of and make sure insurance providers cover the appropriate care and preventative steps, right? And so there's just so much to it, and it's so important. And I also realized very quickly, I'm making this a very long answer to a very short question. The minute symplr became a corporate partner to Komen, I mean, you remember this, Kristin, how many, might have been hundreds of emails did we get about my aunt, my sister, my cousin. I lost my mom, one of my closest team members who helped us set up this call, lost her mother to this. We're all impacted by this, directly or indirectly. And I think it's just such a powerful cause to rally behind. There's so much work to be done. What better way to demonstrate symplr and our team members' commitment to improving the lives through the healthcare system that we serve every day? And so again, stars aligned. I couldn't think of a better way to get engaged, and I couldn't think of a better cause for us to support.
And now you are a board member as well,
Yeah.
with the Komen team, which is pretty incredible. And I think BJ mentioned a lot of the, there's the high level walks, the things that we all see. Why don't we start off with that and then drill in? Because I think what I'm interested in understanding and unpacking a little bit today is some of the stuff that lies beneath the surface. Maybe we're not all quite so aware of. But before we go there, Victoria, will you talk a little bit about just sort of the connections, maybe a little bit about the walks, the things that we're all familiar with from a Komen perspective?
Yeah, I will. I think BJ touched on something that's really, really important. And that's that sense of connection and community that you find at Komen. 1 in 8 women will be diagnosed with breast cancer in their lifetime. BJ mentioned that men are also impacted by breast cancer. But I think a fact that's important to know is breast cancer has now surpassed lung cancer as the most diagnosed cancer in the world. There's not anyone that doesn't know someone who has been impacted by the disease. And when you're first diagnosed with breast cancer, that feeling of being so alone is so powerful. And one of the things that we want to give to people who have been touched by breast cancer, whether it's you as a patient or a person who is experiencing this as a loved one, we want you to see in us the community where you can come and feel powerful against something that has left you so powerless. And so however you try to connect with us, and there are millions who do this, we want you to be helped by us, to volunteer with us so that together we can really make an impact. And, we've talked about our walks and our races, but, those are not just fundraising events. And don't get me wrong, I love the money. Please, raise money, Symplr team, because you're doing a great job. You can see right here on the slides that we're showing the incredible impact that these teams are making. And they are fundraising events, but they really are a gift of healing and hope to the people who've been touched by breast cancer. I mean, think about it. You're coming to your local hometown and you are walking alongside of hundreds, if not thousands of other people who have literally walked a mile in your shoes. And it's hard to explain just how heart-filling these experiences are. So when you're there, and I encourage you all to go, just take a moment and look around the crowd just to see those moments of connection, of community, the support, the love, the mourning that happens, and you will understand the power of what we bring. It's really wonderful. I'm really thankful to all of our colleagues at Symplr who've joined our teams. Thank you for the great pictures. It's awesome. And maybe you're going to walk with us in community this fall. We really couldn't do this work without you, but that really is the underpinning of everything we do. It's all about the people.
I got to attend, Victoria, what was the same event in Denver that I attended a couple weeks ago, and it was a beautiful fall morning in Colorado. Sun was shining, and there had to be 8,000 to 10,000 people at this event, and it almost feels like a bit of a rally, and you're there to support all these people who have been impacted. And then at one part, and they bring me on stage from a board member, and so I get to see the entire landscape. And in the beginning of the ceremony, they basically say, okay, and now if we could actually ask all of our survivors to come down, and the seas part, and you think it's going to be a few dozen women, and it's hundreds and hundreds and hundreds of women who have lived with breast cancer for many of them long, years and years and years. And they come down, and first of all, there's a dry eye in the house. And if you aren't sobbing through that, you are a heartless, soulless human being, right? But I've never seen a sense of community and a sense of, I don't know if it's fellowship or if it's just belonging amongst people who just are so excited and happy to have people who are going through this journey together with others who have. And Komen creates this impact in a way that it's almost indescribable. It's like nothing I've probably ever seen. I've now seen it twice at these two walks. And I would encourage anyone to go and just be a participant there. It's life-changing.
Yeah. I mean, the power, the community, the energy that Komen brings from all of these different connections, it's pretty spectacular. And I can imagine that really has to fuel the work that you and your team are doing, Victoria, kind of in interesting ways, probably ways that we can't even imagine. So there's, maybe the research you did before to the research you're doing with Komen, but tell us a little bit about some of the different things that you and your team are working on. I know there's a lot going on over there.
Yeah, I want to talk about research because, as BJ said, this is a club, but it's a club that we really don't want anyone to be part of in the future, right? No one wants to be in the breast cancer club. And, that's why research is so important, because the goal of our research is to ensure that, this club no longer exists. We're happy to step down from our role of president. So this is why our research program, we have 3 priorities for investment, all in the pursuit of saving lives from the disease. And the first is focused on advancing precision medicine for a personalized approach to breast cancer care. One thing we've learned over the many years that I've been in this fight is breast cancer is not one disease, and it is as unique as the individual person who is facing it. We have to get personalized. The second is really looking at what is responsible for breast cancer deaths, and that's typically when breast cancer becomes metastatic, which means it's moved beyond the breast and has traveled to other parts of the body, like the bones, like the lungs, like the brain, and that it takes over, and that's what's driving the majority of breast cancer deaths. That is a priority for us to address. And finally, our research is focused on eliminating breast cancer disparities, because despite all of our great advances, those advances are not being enjoyed equally by all people. So we really need to achieve health equity in how we're addressing breast cancer. So I dropped a huge number earlier for research, right? $1 billion, right? And, as the great Stan Lee once said, with great power comes great responsibility. And so, at Komen, we really, really have to be good stewards of our donor dollars. And these amazing investments are made with the guidance of Komen scientific advisors. And I want to share that we have many of the world's most recognized leaders in breast cancer research and clinical practice. They work alongside us. They help us identify where are the gaps, where are the opportunities, and how can Komen lead with our investments to drive innovation. I won't name drop, but I'm going to discovery drop here. So, the scientists who identified the first breast cancer susceptibility gene, that's BRCA1 and 2, one of our advisors. The scientist who helped put tamoxifen on the market, one of the original leading treatments for breast cancer targeted therapy, also one of our advisors. And the list goes on and on. We've got great people working alongside us to help drive future discoveries. But one of the big differentiating points about our research program that I think is really worthy of mention, because it goes back to our patient centricity. There is not one thing that we do in science without a patient alongside us. And so that means participating on this scientific advisory board, and they contribute directly to the strategy I just described. And every time we look at a potential research investment, we have a patient serving on that review panel because we want to be aligned with what the patients actually need and want. We've heard a lot about how clinical trials sometimes are designed without the patient in mind. We don't want to continue to support that. We want patients at the table. And then finally, if that's not enough, every investment we make, every funded research grant, you have to have a patient as a member of the research team. That's important for us at all steps of the process. The ultimate beneficiary of this work has to be a member of the team. This is what we believe, will really drive that patient-centric approach to personalized medicine. Yesterday, treatment for breast cancer was kind of one size fits all. And, we all know that's not true, men and women, right? Today, our investments are really looking at driving precision therapies that have been developed after years of laboratory research. And we've invested in this to unravel the biology of breast cancers. So I'll give a little biology lesson if that's okay. So the biology of breast cancer that tells us, what are the strengths and weaknesses of breast cancer? Like, what is that? And that's what gives us a roadmap for targets, for targeted therapies. And so new drugs, combinations of existing drugs, those are now being designed to hit those specific targets. This is really important not only for better outcomes, but if treatments target breast cancer and not healthy tissues, that means fewer side effects for our patients. That is the gold standard for what we're hoping to achieve. And so do we have time to get into a couple cool areas of research that Komen is investing in?
Now that we've got our biology lesson, like Pat, yes, let's go right there.
Let's jump in.
The first biology class I've taken since like 11th grade, so that was super.
I left out the glory of the cell cycle. The glory of the cell cycle was not put on this presentation, but to all the folks watching, if you want to see my 145 slides about the pathways, I can come and deliver that presentation. But let's just talk about some of the big discoveries that are happening, because you're seeing a lot of this stuff in the news. And I know, we've all heard about vaccines, right? Another fancy way for talking about immunotherapy. And so unlike getting a flu shot, this is a little bit different, right? Immunotherapy in breast cancer is a treatment, and it's helping to harness the power of the immune system to fight breast cancers. This is one of the areas where we've seen really dramatic change. When I started 25 years ago, the virologists were presenting in the basement of the big cancer conferences. Now immunotherapy is really showing great promise in breast cancer. There's been a breakthrough specifically for people with triple negative breast cancer. It's called triple negative because we actually don't have a target yet. but great promise. Immunotherapy is actually working in this type of breast cancer. So we're really excited to see that. And so now Komen is supporting several research projects that are pursuing new ways to make more types of breast cancers responsive to this new class of drugs for our patients. Super exciting. Second thing I'll share, I think we hear a lot about this in the marketplace, and especially for you all in the technology space, is AI. Everyone's talking about AI. And so treatments are not the only area of research where precision medicine is evolving. We're really looking to improve this by leveraging artificial intelligence alongside imaging. You may have heard about AI approaches that help mine, mammogram images, and they can detect sub-millimeter evidence of breast cancer, even before breast cancer could potentially be seen by the naked eye. This is the earliest of early detection, and we funded those studies with our scientists at MIT. Really exciting to see the explosion of these new technologies on the market. But that's not all. But wait, there's more. Not a set of Ginsu knives. There are even more things happening in research. Because what if you could combine the data from those mammogram images, a person's health history, and maybe a blood or saliva test, use AI to combine all of this complex information and identify who might even be at higher risk before breast cancer has even developed. That's some of the work that we're funding right now, is to get even earlier in the pipeline using AI to give people a roadmap for their care long before breast cancer even started. And this is the beginning of, I think, what we can do using new technologies and innovations like this, learning, what we've learned from that biology and really translate this into really cool stuff for the future.
So I'm going off script here, Victoria, because I got a question about this. So as a person who do the mammograms, go into the rooms, they're cold, does not feel high tech at all. I love everything you're talking about. How long does it take to go from what you're talking about, trickle down into kind of the average consumer, the average woman's world, human patient's world, where we're actually able to see some of these technologies in action?
I think we're going to be seeing the introduction of new technologies like this in just a few years, if not sooner. There are a lot of these types of technologies now coming into the market. One important note about tech versus treatments. So the FDA approval for technologies does not follow the same process as we do for treatments. So when you're looking at new tech, you need to be careful and take a look at the evidence and work with your doctor to see, does it really replace the best technology that we have on the market today? So that's a lot of the work that's going on right now. Because we know that it functionally works, but is it as sensitive and specific at finding the evidence as what we have right now? That's a lot of what's happening now. And I think we're going to see good evidence in a couple of years. Still early on, but what you're seeing come to market is the result of decades and decades of research. We were talking about imaging like this at the beginning of my career, so it's been a long time coming. Mammography is sort of 1950s technology that's been, it has been iteratively improved, right? We now have digital, we now have 3D. Think of this as the next generation, and it's coming soon. What we're looking at Komen is ensuring that the information you get back from this technology is safe, it's accurate, and it's going to give you the right roadmap to make good decisions about your care. So one quick commercial, if you don't mind. Komen has a series. It's called Breakthroughs in Breast Cancer. And our team of scientists who work with us here at Komen, they talk about all this emerging technology. And they tell you all about the promise and the pitfalls. And they let you know when things are coming soon. And then you can go back to our website and learn where do these things stand. So that's another long answer. BJ, I think I'm taking a page out of your book.
No, you may. Well, I'm just. Kristin knows scripts are nice to have, but they mean nothing to me. No one knows this about symplr. We actually, part of our business, and it's a wonderful part of our business that a lot of people don't, I think, know that symplr acquired a couple of years ago is we actually own a business called Hayes. And we actually have dozens of scientists, some PhDs on staff that do extraordinary research to actually determine the efficacy of new technologies and think devices, right, that get introduced in the market. Now, we do it under the context of a lot of times reimbursement on the payer side, right? Like, hey, Dr. X plays golf with medical device rep Y, who has a new laser scalpel that costs $300,000, and that system is now being asked to reimburse, right, for 10 of these. Well, wouldn't it be good to know if it actually delivers the outcome that it purports? And so we actually have scientists that look at all the data and research available and publish extensive efficacy based findings, and effectively it's a Hayes rating, right? And either it demonstrates and delivers the value it says it's supposed to, the technology actually works, it's inconclusive, or yeah, they're just full of crap, right? And it's amazing how important it is to actually do the research around the technology, because it's coming so quickly at these physicians and these clinicians, and not all of it works as it's intended to. So I do think, as you pointed out, really spending the time getting the data, evaluating its efficacy before you actually introduce it into patient workflows is so critical. And it just resonated with me, because we actually, it's growing, it's a very fast growing part of our business, interestingly enough, because it is so important right now. The pace at which technology innovation and potential adoption is coinciding with the usability or consumability of these health systems is unsustainable.
Yeah, well, and you make another good point about why that type of research about efficacy is so important, because the last piece of this puzzle is what you mentioned. It's affordability for the patient. And so in order for payers to catch up with discovery and put it on their formulary, have it covered by insurance, we need the body of evidence to say that it works, it's more effective, it drives down costs. So this is why all of this is really important. You know, again, much like research, if we make this technology and no one can afford it or access it, we haven't done our job. So this work is really, really important to ensure that everybody can benefit.
Awesome. Now that's a great segue into a question I have actually for both of you, and it's a little bit about access, broad access, population access, and really kind of thinking about health equity, which I know is a core priority for Komen. You mentioned that. BJ, I know equity, thinking about disparities, how do we sort of service kind of the many is something that's very important from a symplr perspective as well. I guess my question for both of you is, as you think about outcomes in the work that you're doing, how do you do that and balance that in a world where we do have, you know, a history of disparity in some of these areas, and maybe haven't been so, we haven't approached this notion of equity maybe the way that we should have, and how are we thinking about it today?
Who wants to go first?
I'll tell you what, you have a lot more impactful content here than I will, so maybe just a couple of thoughts from symplr's point of view, right? And please, you can keep me, what you can do is you can actually like fact check my data. This will be like one of the debates, right? You can actually keep me honest in real time. So it's not like some politicians spewing facts that mean nothing, right? So in our country right now, a Black woman who is diagnosed with breast cancer is 60% more likely to die of that type, 4 times.
40.
It's still whatever, it's a horrible number, right? Mine was even worse, so I'm glad it's not that bad. But it's 40% more likely to die of that diagnosis, right? That's ridiculous, right? And there are so many causes to that. There is no silver bullet here, obviously, or else people would have solved it. There are so many different drivers of the reason for that. One of the things we see, and I'll put a symplr lens on this, right, which is a non-breast care specific point of view. I don't know if everybody knows, but there's a massive shortage of healthcare workers in our country. Right, there's a 43, as we're tracking it, 43% shortage of nurses right now, 17% shortage of physicians. And that's as the boomers are aging into a time, right, when that healthcare demand is going to far outpace the supply that we can actually fulfill. This further exacerbates the health inequity problem because we can't even come close to filling the demand that exists today. And if we have a healthcare workforce problem, we are only going to accelerate or compound the inequities we see today, right? You're going to see a further divide, right? Some people think of it as a wealth divide. This is a healthcare divide, right? Between those who can get access and those who can't. And so symplr's point of view on this is the more we can make productive use of time, in effect, make sure nurses and physicians are spending the most time providing care and not doing administrative work, the more we can in our own little way, right, help to free up demand, which in some ways begins to address through capacity some of the health inequity that we see in US healthcare system today, right? And then obviously, Victoria, you have many of the very specific reasons within breast cancer population. So maybe if you could go there. We see broad-based US systemic problems that we're trying to help solve. But if we don't solve some of these bigger fundamental issues, the blocking and tackling, nothing in any of the discrete areas are going to move the needle materially.
You are 100% right on. And, you know, when we look at the issue in breast cancer specifically, our scientific advisors say that as many as a third of people who are losing their lives to breast cancer could be solved just by getting them to high quality care that exists today. So that's not a research breakthrough, that's a breakdown of all the barriers to care that you've just described. And you know, and I'll give you a pass. 60% isn't completely wrong because 40% more likely is an average. So that means in some cities that disparity can grow as high as 74%. That's the difference. And so you're not wrong about that issue. And we believe that a lot of these issues could be solved by looking at, you know, some of the systemic barriers. But I want to talk about, you know, what's happening on a global perspective, because, you know, breast cancer is a global issue. I mentioned it was the most common cancer around the world. It has overtaken lung cancer. It's the most common cancer here. It's the most common cancer in China, in India, and many other countries. And incidence is rising dramatically in some countries. So to compare, here in the US, our incidence of breast cancer has risen by about 0.5%. If you look at India, the incidence has risen by nearly 40%. And so to me, it's important that we look at breast cancer globally because the people there live here in our country, and they have brought their genetic profile with them. They have brought their, you know, their family health history with them. And so we need to look at breast cancer globally and to figure out what's going wrong with these differences. You know, we've talked about the incidence in Black women in the US. They are also diagnosed much younger and with a more aggressive type of breast cancer. And that's an experience shared by younger women from Indian backgrounds, Chinese backgrounds, and other countries. There's a lot that we need to look at in terms of disparities. So while we need research and research breakthroughs, I want to talk about one of the interventions that Komen is investing in to help solve those systemic barrier issues that we've talked about. And so BJ talked about the issue of the workforce. When we surveyed our patients who are experiencing health inequities, the number one thing they said is, I don't trust my healthcare provider because they don't look like me. They don't understand my community. They don't understand, you know, what it's like to walk a mile in my shoes. And so exacerbated with the problem of lack of healthcare providers is a further lack of a diverse workforce that can build that trust between providers. So one of the things that Komen is doing is we're investing in building a workforce to address this issue. We invest in young scientists to put them at the very beginning, you know, of the discovery process to find out what interventions will work. But on the ground in community, we have developed a free online training program to drive patient navigation. The navigators are there to answer questions. They get patients connected to safety net services, provide financial assistance, a lot of emotional support. You know, we do this at Komen. We built our patient care center and our team of navigators. We did it in 2 years during the pandemic. Everybody else was working on a sourdough starter. We had a different bun in the oven. It was patient navigation, right? And so, you know, we've served about 40,000 people a year through this program, and we know that the program is working. I'll just share briefly, our most frequent request is help with housing and food. So I want you to think how heartbreaking it is to hear of patients who are going through treatment, they can't work, they can't afford to feed their children, they're worried about being evicted. And this is a situation that more than 50% of cancer patients are facing. 50% of cancer patients miss treatment or stop treatment altogether because of financial issues. And so this is why patient navigation is so important. We can connect the dots. I want you to think of a patient navigator like a mammogram. Everyone could benefit from one. Everyone could benefit from holding that hand. The last thing I'll mention real quick, and I know we're running out of time, but I want to address, I talked about the 1/3, but there's the other 2/3 that are losing their life, and that's why we need more research to understand the why. And a lot of the why is also wrapped up in a discussion about health equity. Some of the why, I believe, is because diverse populations aren't included in research. So we know a lot about what works in a sliver of breast cancer patients. We haven't studied it in everything. Less than 10% of clinical trial participants are from a racial or ethnic background. So think about all of the new treatments and technologies. They are not tailored to that population. And that's what's probably also leading to poor outcomes. And so we know that patients aren't often asked to be in a trial, or if they're asked, they can't access the trial because they don't qualify, or if they can access, they can't afford to travel the long distances to that big university cancer center. There's a lot of barriers. And so one way that we're hoping to overcome these barriers to really getting a diverse perspective for research is to create our own patient research registry. We launched it this year. We're calling it Share for Cures, because we believe our community of millions of volunteers who show up in pseudobit races will be willing to volunteer to show up and share their data for the cure. Just 3 criteria to participate. You just have to be an adult diagnosed with breast cancer living in the US, and you can participate. We will get your medical records. You'll give us a saliva sample, answer some survey questions, and we're going to make this data available for research. This is really transformational for Komen, from being seen as a funder of research to now being a provider of actual research data that we believe is really going to drive discovery and help to resolve some of the health inequities.
And Victoria, is that Share for Cure, is that already out there? Is that a website, or how do we connect people to that? That sounds terrific.
I'm so glad you asked. Yes, we launched in July. We're really excited. You may have seen us at one of the walks. Please come, team. Please come to the walk. You can learn more about it now. But you can learn more about Share for Cures by going to komen.org/share4cures, all one word, and learn how to sign up. Super, super easy to sign up. It just takes a few minutes, and we would love to have everyone join.
Oh my God. I mean, we talked at the beginning about how everybody's been touched by breast cancer. I've got a couple friends right now dealing with treatment, and I'm absolutely going to be passing along that comment and the Share for Cure website. You know, the other question I have for you, you were talking a little bit about the navigator program. How do you connect the patient needs to the navigators? How do we make that connection happen?
So the first step is a phone call to our patient care center. So you can call us at 1-877-GO-KOMEN, or send an email to helpline@komen.org. And there will be an oncology social worker on the other side who's ready to listen to you. And we do an entire intake to understand, what are your needs? You might be calling with one need, and in the conversation with our social worker, we might figure out that you actually have more things that we can help you with. And so let us be that one-stop shop. We don't replace what's happening in the healthcare system. Think about us as being a partner. We're there to fill the gaps and to help you through those unique things that you might not be getting in other places. And so we start there. Sometimes our patients might just need help for a short time, and they'll talk to us for an hour or maybe a week, and then we resolve their issue and they're okay to go on. Some of our patients are with us for months. Some of our patients are with us for the entire course of their treatment. Whatever a patient needs, we figure that out, and we try to help them make those connections for what we can provide, what can be provided in their local community, and we do this together.
I don't think you can overstate the impact that these navigators have on those who have been diagnosed, particularly at the beginning of their journey. I had a former colleague who reached out to me upon seeing that I was on the Komen board, and I asked Victoria, if you remember Victoria, a few months ago, she needed some help for her daughter. Yeah. Anyways, we got her in touch with a navigator, and I found out, a couple months later that they had been able to actually point her to the resources that she needed at that moment in time. Tons of education about what they should be expecting, the steps along the journey, connecting to others. It's these are lifelines for people going through their hardest moments, and they can feel so alone. And again, I think you mentioned it earlier, so isolated. And just having someone to say, hey, you're not alone. Let's get you some help. We see this. We know how to, we know how to help you in this unfortunate process you're going to go through. Was it was a godsend to them. And again, they're just amazing humans doing amazing work. And it's not, you cannot overstate the value that they provide to those who have been diagnosed.
And if I didn't say it before, I want to say it again, since I know this is the research presentation, but navigation was actually proven through research, it reduces health inequities. So this actually is a research tested intervention that is proven to eliminate inequities. This is why we established it, why we did it, why we continue to support it. We know it makes a difference.
Now we've talked a little bit about this whole 360-degree approach, right? I heard notions around, obviously a lot around research, a lot around community action. It feels like some of this fits into that action portion. Care. Is there anything that we missed as we kind of went through the overall Komen approach, Victoria?
I can talk just a little bit more about advocacy, how important this is in both of in our state and federal level, is to really advocate for access. And we talked a little bit when we mentioned technology, is really to have that body of evidence to be sure that coverage and accessibility, affordability are all tied together so that patients can benefit from what we're doing. That comes from hardcore advocacy. One piece that I want to mention that we're working really hard to achieve is to provide coverage for diagnostic services to patients that need them. And this is, I think, perhaps a bit of a misconception in the community. We all know about screening mammograms, but that's just your first journey to an accurate diagnosis of breast cancer. You go in for your screening and there's something abnormal, you need to go back for further testing. But many patients are surprised to hear that while the screening mammogram was covered by the Affordable Care Act at no cost to the patient, that is not true for the diagnostic follow-up. So in some of these diagnostic tests can range into the thousands of dollars. So think about, what we're trying to achieve with saving lives, right? We want people to get screened, but wait, now they can't afford to get their diagnostic test. That's not supporting our mission. So we're fighting both on the federal level and in every one of the states to ensure that insurance coverage is being extended to these diagnostic tests. So the power of Komen and our advocates is pretty strong. We've passed this legislation now in 20 states across the country, and we're gearing up to head back to those who have not yet, heard the pink message. We're going back in January and starting again to really, have coverage across the state. This is really, really important.
I got to experience this firsthand. I joined a delegation of the Komen team as part of the board, actually lobbying on Congress a few months ago. I think it was in July. Keep me honest here, Victoria. The year is really, but we got briefed and we showed up and we talked to these senators and congressmen and women, and we some of them we were looking for co-sponsors of very specific legislation. Some of them we very clearly showed up and said, hey, what are you doing to help support breast cancer in your communities? And what I'll tell you is, even for the folks that can't donate, right, there are so many ways to get involved in philanthropy, and so many folks say, well, I don't have the means to donate. And trust me, that's very real in our country right now. Every one of you is a taxpayer. If you're listening to this, every one of you is a voter, right? You have a congressman or woman who answers and reports to you. And if you're not on them about the causes that matter, right? We spend trillions of dollars a year in this country. Are we spending it on the right things that'll impact our community the most? This is the most prominent cancer in our country right now. What are they doing? What is he or she doing to help those who have been diagnosed, or to help prevent those that could avoid a diagnosis in the future? And so pick up your phone, get on the email, get on their website, right? What are you doing to help breast cancer in our community? Get involved as a citizen with your representatives, be they state, be they federal, and make sure they're putting the dollars and the support behind things that we could and should be doing to take care of our country and our citizens. I said to one of them, I stole this from Komen's CEO. He was a former Army Ranger, Marine. We had a different way of talking to each other. I think scared some of the other people in the room. I said, listen, if our CEO calls 1 million pink women with pitchforks, right, to show up in front of Lincoln Memorial, you don't want to be on the wrong side of that, right?
Yeah.
You don't want to be a representative not supporting breast cancer awareness, treatment, research, et cetera, et cetera. And he went, you are absolutely correct. I do not. How can I help? So anyways, you know,
100%,
like a Marine threatening a Ranger, right? But it, but they got it, right? They got it. And they want
we're going to parachute in. It's going to be great. But this advocacy works. And, you know, and you mentioned, you know, the letters and the calls, and people often ask, like, you know, does that really work? And the answer is 100% yes. There are staff on the Hill in Washington, in your state capitals, who are dedicated to answering those emails, answering those phones, and keeping track for the elected official what is on the mind of their elected constituents. So it actually does work. And so, BJ, you mentioned, you know, do this for your elected official. And I know there's some folks who are like, oh, who's my elected official, right? I get it. But we've made it really easy for you, right? We made it really easy for you. You can go to Komen's website and you just put in your zip code and we'll tell you who your elected folks are. We make it even easy for you with template letters that you can just, you know, hit send on. Even the template letters make a difference. I promise you it does. The last thing I'll say is, you know, be sure to keep track with Komen, because if you're interested in this and learning, and as BJ said, this doesn't cost anything except your time and your advocacy, right? And so we, in addition to letters and calls that we do, we also do local events in your state capitals where you can come and we'll teach you how to do these visits and tell your story and knock on doors. We'll show you how this is done. And really, it's not about the, you know, polished stories per se. It's the raw reality of your everyday life that really makes a difference. So don't worry that you've never done this before. It doesn't matter. Your voices are important. So you can come locally. You can come next year in June, June 10th and 11th in Washington, D.C. Mark your calendars. BJ will be there. You can join us in D.C. too.
So this is great. I mean, we're handing out advocacy lessons. We got biology lessons. We got research covered. Like, this is
threatening
like,
congressman.
Boom. Right? Just kind of bam, bam, bam. All kinds of learnings here. I would encourage everybody to jump into the Q&A. So we want to leave just a few minutes for your questions. Make sure we're addressing anything you want to know. We do have a couple of questions, and I just wanted to kind of hit on those a little bit right now. So we've got about 10 minutes, and just as a sort of a housekeeping item for those of you that are joining us, you can, in your GoToWebinar, go in, you can hit that little Q&A question and pop your questions in there. But our first question is actually, what volunteer opportunities are available for those without a breast cancer diagnosis?
That's a great question.
Yeah.
That's a great question. And I would say pretty much all of them are available to anyone without a breast cancer diagnosis, with the exception of Share for Cures. The majority of our volunteers, you know, I talked about millions of people who engage with us. The majority of those people are not breast cancer survivors themselves or people living with metastatic breast cancer. They're just the friends and the family and the daughters and the mothers of the breast cancer patients. So if you come, you will be alongside other people who are like you. The definition of an advocate is just someone who is going to show up and stand up and speak up on behalf of someone else, right? That's you. You can be a volunteer and you can be an advocate. So you can come to our races and walks. You can sign up to be an advocacy insider. You can do a variety of other things. I didn't talk about the volunteer program we have. If you're interested in research and want to learn how to be one of those patient advocates I talked about that are in every part of our research program, that program is called Advocates in Science. And if you'd like to do that, you can join that too. But if you go to our website at komen.org, there's a section called How to Help. And it really outlines a lot of the ways that you can get engaged in our mission just by being an advocate.
I mean, advocates in science, that sounds like something I might want to sign some of my kids up for, that in addition to myself. I love that. That's
Oh, wait, I have something for kids. Okay. So I have something new to share. Brand new, hot off the presses. It's called Go Pink for the Cure. Okay. Now this is for our high school students, our grade school students. It involves the student council, the clubs, all the sports, the volleyball teams, the football teams, the hockey teams, the swimming teams. Any school group can get involved in Go Pink for the Cure and build their own fundraisers for Komen. So think about all the fun things that you do with the kids, right? It's the most wonderful time of the year, not just because it's NABCAM, but the kids are back in school, right? Terrific. Think of all those activities that you parents are doing. Think about turning them pink. And what a great way to introduce your kids to the idea of like philanthropy and volunteerism and getting back. So the truth is, a lot of our kids now are seeing breast cancer firsthand, like in their teachers, in the moms of their friends. And it's a way to like bring them along and support them and teach them and make them feel like they're making a difference where they are.
Go Pink for the Cure.
Go Pink for the Cure.
Yeah, that's a good one. That's a good little nugget out there. One more question I've got here. I think we've got time for it. So Victoria, you've talked a lot about changes with Komen. You've been there 13 years. What are the most significant research changes you have seen?
Oh my goodness, there's been a lot. So I've been at this for 25 years. And, as I mentioned at the top of the hour, in the early days, we thought of breast cancer as one disease. And now we're learning that it is not only a collection of diseases, but a collection of biological markers that help dictate treatment. This will be my last joke of the day. You can't hit a cat without, swing a cat without hitting a biomarker at a scientific conference. We are, come to ASCO, BJ, you'll figure it out.
Little did we know that there were so many cats getting swung around in scientific conferences.
You never know, first time for everything. But scientists are really, really unpacking the biology of breast cancer and figuring out new ways to target where we've not targeted before. That is a huge change from the early days where a lot of the options were not options at all. Everyone was getting very toxic chemotherapy. People were going in for very radical mastectomies, very disfiguring, life-altering diseases. Huge change in how we're treating breast cancer. The huge benefit of that is that breast cancer continues to be deadly for some, but not all. We have had a reduction of more than 40% in the mortality rate, and that's huge. But most importantly, we're also seeing life-saving therapy for the men and women who are living with incurable metastatic breast cancer. And I think this is really important to mention. Contrary to popular belief, metastatic breast cancer doesn't happen because people didn't receive an early diagnosis or treatment. What's happened is breast cancer is smarter than the smartest things that we have on the marketplace today. And for some reason, a person living with metastatic breast cancer, their breast cancer has failed to respond to all the therapies on the marketplace. And someone who has done everything right may find out that 5, 10, 15 years later, their breast cancer has come back and is incurable. So there's a lot of focus now on finding treatments to help people living with METs live longer, healthier lives, and we are becoming much more successful. The work is not done, but that also is a huge change since the beginning of the movement.
So many topics we've covered today. I mean, it is Breast Cancer Awareness Month, and I am surrounded by some of the smartest folks out here, well, at least a few. But from a breast cancer point of view, I mean, Victoria, thank you so much for joining us. You've really, I think, opened many of our eyes and our minds to so much of the terrific work that's going on at Komen. BJ, thank you for bringing Komen into kind of the symplr world and exposing us to some of just a few of the things that are going on. It's pretty powerful what we're hearing today. And to all of those who have joined us, have taken time out of your schedule, we really appreciate you being a part of this. If you have more questions, there's a lot of resources on that Komen page, but we're always here for you as well, and would be happy to sort of take any questions you have and make sure they get to the right folks over on the Komen side. Thanks for joining, guys.
Thank you so much for having us.
Thank you, Victoria.
Take care, everybody.